Welcome back, everybody. We have one more segment, as I mentioned, that will just provide a lot of resources that you can access and review when you're considering Medicaid data for research. And I will just turn it over to Kendra. I'll stop sharing for you.
Steph, okay, let me see.
Yes, we can see that.
Great. So like Steph just said, to wrap up today's session, I'm going to present Medicaid research support tools. And so far we've covered a ton of information on the Medicaid program, the Medicaid population, and the specific Medicaid research files. And we got a decent preview of a few of the resources that are helpful for understanding the research files and the exercise and some of the other segments so far. So I think those all flow really well into this segment. And I think, like we've been saying, when it comes to Medicaid, there's always more to know. So the complexity of state administration over time and changes over time means that every time we've been saying, well, the answer depends on the state in the year, or that in order to pursue a research project, you're going to have to do a little legwork to make sure you have the proper context for your question and your study. So we want to introduce some resources that are useful in planning stages, when you're working on your data request or prior to working on your data request, and then even as you're working on analysis. So this isn't going to be complete, but I think it's a good starting place if you're wondering where to gather information. So the categories I aim to address kind of mirror our sessions so far. I'm going to start with Medicaid program descriptions. This is where you can go to learn about the administration of the Medicaid program. Since these are administrative data, of course, it's crucial to understand how the program is working. And I have a long list of places where you can go to learn about the files. I'll start out with national resources, and then I'll also call out a few resources that you can look at from more of a state perspective. And then I'm going to wrap up the program description information with a little application to managed care. I'm going to briefly cover Medicaid statistics, what kind of summary information is publicly available to get a sense of what's happening in the Medicaid program. And I'll be focusing on things that have been published by CMS. And then finally, I'll move into research-specific resources. So what resources have been produced for the CMS Medicaid research files, the MACs and the TAF, moving beyond program information, what's actually supporting the file production process and what we know about the research data. So again, Medicaid's a joint federal state program, and you can start with national information for an understanding of what's shared under mandatory coverage. So there are some resources on national requirements for Medicaid available through CMS. Later, I'm going to refer to a couple other resources that we've already mentioned in other segments, Kaiser Family Foundation and MACPAC. Again, this list isn't complete. Some of these resources may duplicate, but I want everyone to know that there are lots of options for exploring. I'm going to start by walking through the Medicaid.gov website. Honestly, it's probably not the most glamorous of all of our presentations so far, but we have 40 minutes, and I think sometimes you open up this page and there's a ton of information. It's a little daunting. So just that little exposure nudge is enough to get inspiration, I think. So if you go to Medicaid.gov, I'm just going to walk through what's in some of these different tabs. The first is federal policy guidance. This is a search page for regulations and supporting informational bulletins, state health official letters, state Medicaid director letters, some frequently asked questions. This has all been issued by CMS in order to facilitate state implementation of Medicaid. And they'll cover topics like managed care, Medicaid, Medicare, coordination, duals, quality of care. And the screenshots from last year, but just last week I looked, there were 4 new posts that covered things like Medicaid eligibility for COFA migrants, COVID-19, and the American Rescue Plan. You can sort through resource or topic. I think the takeaway, if you're looking for supporting documentation to explain federal changes, this might be a good resource. It might be a good place also to look for a question. If you're wondering what the impact of a regulation is, this might be a place to help brainstorm and find those regulations. Similarly, there's a dedicated page for state resources. These tend to be focused on special topics like the Medicaid Innovation Accelerator Program. A lot of pages are designed for the contractors outside of Center for Medicaid and CHIP services that are focused on specific programs. So some of these contractors that work more specifically with home and community-based services or managed care. I think if you're looking for additional information on special programs and their implementation with more of a state perspective, you might want to look here. Really, the research friendly page is in Medicaid and CHIP, and there's program specific information split into those two tabs. And as you can see, there's a lot here. I'm not going to go into a ton of detail, but it's worth checking any of these out if you're curious. And the text is kind of small, but I'll call out a few specific things that I think are useful. One is an archive of Medicaid state plan amendments. So here you can actually pull up all amendments that states have submitted for their Medicaid plans. A lot of these are topic specific resources for states. So if you open up something like access to care, you'll get a definition, the corresponding guidance and regulations, reports focused on that particular topic. If you look at something like enrollment strategies, you're getting information on presumptive continuous express lane enrollment. So you can just learn a lot about what's going on in conversations about program administration. If you're thinking from a research perspective, these pages can offer information that help with understanding. You can get a definition of a lot of different things. So if you click on almost anything, you'll get an about description. So you can learn about cost sharing, Indian health and tribal consultation. There's a definition of waivers and demonstrations, information on managed care, and then summaries of benefits and even specific benefit pages. And you should look into any of these if they're relevant to your work. I want to draw your attention to just a couple other resources on the Medicaid tab. Under program information, you can get eligibility levels. And I think earlier there was a question about CHIP eligibility. There's actually a table with all states, different eligibility categories and income standards for those eligibility categories posted here. You can also get enrollment data. So I think Steph mentioned earlier that there are other reports that get submitted to track federal financial participation, the Medicaid budget expenditure system. So there are MBES enrollment reports found under program information. Like Medicaid, this CHIP tab has information by topic and program benefit, but it's CHIP specific. Similar to those MBES reports, there are enrollment and expenditure reports specific to CHIP. So they're derived from the CMS 21, which is the accounting statement of expenditures for CHIP. So if you're interested in CHIP, you might want to be looking at the resources here. The last page that I'm going to cover is state overviews. You can get state profiles through this page with summary information by state on eligibility, enrollment, data quality, and corresponding program documents. So those state plan amendments you can pull up in the resource or in the Medicaid tab, but you can also pull up information by state. So you can get their amendments, demonstrations, and waivers just by looking at a specific state. There are also some more rating systems, so national context and health system performance information that you can pull up. So besides the CMS or Medicaid websites, Kaiser Family Foundation resources have a ton of information. If you look through what they're citing, it includes CMS, Medicaid, Urban Institute, the National Committee for Quality Assurance, and MACPAC, CDC prevention status reports. Kaiser Family Foundation also has an annual Medicaid budget survey where they're surveying Medicaid directors. So there's a 50-state survey that also is used for a lot of their reporting information. So you can They have just a general Medicaid page. There's a variety of resource types. They're grouped by topic. Some of it's more reporting, some of it's news releases. You might find lit reviews. One resource that was in the exercise was the waiver tracker. So you can get information where they're tracking changes over time to policies and programs. There's a lot of independent data collection. Like I said, they're operating with surveys, and you can get reports and articles. One resource that's housed somewhere on here is one of their background basic 10 things to know about Medicaid. I think that's in week 5 of ResDAC technical advisor training. So something that's helpful if someone's learning about Medicaid as a program. And they also have a ton of summary reports. They're found under state health facts, and then you can filter by Medicaid and CHIP. And there's information where they're tracking expansion, eligibility, and enrollment, and then actual spending and utilization. So a ton of information can be found here. I encourage you to look around. I think it answers some of the questions that came up earlier today. The last resource for national program information that I want to highlight is MACPAC, or the Medicaid and CHIP Payment and Access Commission. From their site, MACPAC serves as an independent source of information on Medicaid and CHIP, publishing issue briefs and data reports throughout the year to support policy analysis and program accountability. The Commission's authorizing statute outlines a number of areas for analysis, including payment, eligibility, enrollment and retention, coverage, access to care, quality of care, and the program's interaction with Medicare and the healthcare system generally. So I'm just going to walk through the tabs on their site. Medicaid 101 is kind of similar to that 10 things to know about Medicaid on Kaiser Family Foundation site that I just mentioned. But like I said, overlap lets you choose what works well for you. I really like how MACPAC has organized their topics. So if you click on one, you'll get a general description, and then there's also sort of a hierarchy where you can get links to learn more about other things. So if you click on something like program administration, there's a basic summary, but then it will also provide links to waivers, state plan, administrative data. So I think that's really helpful. It also links to publications, the next resource I wanted to highlight. And we're moving into resources where we're getting insight on policy discussion. So you can see what are people making choices to evaluate, summarize, and present. And I think one of the most recent publications is on rate of churn and continuous coverage in Medicaid and CHIP. So it sounds like we're in sync with MACPAC based on what we've presented today. The last resource I wanted to highlight was their MACStats report, and I pulled up the 2020 version. It's a 166-page report if you look at the complete Medicaid and CHIP data book. And it's intended to combine data across different sources that might otherwise be hard to obtain, and some summary statistics. There's information on federal matching, eligibility levels, and access to care measures. The sections include key stats, trends, enrollment and spending, eligibility, beneficiary health, service use, and access to care. So that's a good resource as well. Okay, so we've made it through my 3 national resources for understanding Medicaid. If you're interested in a subset of states or even details for one particular state, you might approach your search a little differently. Again, the Medicaid.gov site has plan and waiver information. You can get an overview of waiver types, access to descriptions of state-specific waivers, and then in those state profiles, you can get information on how a particular state is administering its program. Similar to those state profiles, Kaiser Family Foundation posts state Medicaid plans and state fact sheets where you can compare key data for Medicaid coverage, access, spending at the state level to the national context. So that can be really useful. You can also find information on some state Medicaid agency websites. These vary a lot, and if you're like me, you could spend a lot of time searching around. The reason these might be useful is that you might get more granularity at the state level than what's available in any national report. So any national report is going to have to reflect information that's shared across states. It's going to have national eligibility categories, whereas states might have their own programs and be able to report on that specific program. I looked at every Medicaid agency website before this presentation, and I think about a third of them have pretty good data and reports. So you should look into those if you are looking at particular states. And the easiest, I don't know if this is faster than Google, but if you're trying to get to those on the Medicaid.gov site under Contact Us, there is a link to get to each state agency's website. It's more recipient focused. So it's like, if I'm a Medicaid recipient and I want to contact someone about Medicaid, who do I call? But it's an option. It's a way to get at least close. To wrap up the program information section, I wanted to provide an example of a topic that you might want to investigate with these resources. So we just talked about enrollment and disenrollment, and in all of our segments so far, I think we've mentioned that managed care can have major implications for your project. When we're looking at applying these resources, or how do we apply these resources to a particular topic, I kind of split it out into two pieces. So we can start with broad information about managed care and what's happening at the state level. So this is this background program description, kind of what I've been discussing so far. Where can you go to learn about how the program's being administered, who can be enrolled or who's excluded from different programs? Does enrollment in managed care differ by eligibility group or even residence location? What services are covered? A lot of this information is in the managed care program report that's posted on Medicaid.gov. And I think this lets us think about how enrollment might be different, or how we're creating cohorts that we're capturing maybe artificially by looking at specific subsets of groups. And then maybe a second step goes a little farther. So beyond how the program is set up, what's the impact on data? So you can apply our knowledge of a program to impact on utilization. So maybe it's a comprehensive managed care program where everything's covered under managed care, or maybe it's a restricted benefits where other utilization's getting covered elsewhere. Again, we talked about state plan or penetration of managed care plans in different states, depending on the number of recipients actually enrolled in managed care. Is that impacting what data are available? And then reporting, quality of reporting is essentially plan specific. So it can really depend on how well a plan is submitting data. So you can think all across the spectrum of how a particular issue could impact the data that you're looking at. So I spent a lot of time so far talking about the program, but I think it's appropriate. It's about the level of investment that we expect relative to the rest of the resources that we're going to cover. I'm going to focus on CMS offered public use files for Medicaid. These differ quite a bit if you're familiar at all with Medicare public use files that are created from the administrative and claims data. With the complexity of Medicaid, there aren't these clear national summaries, since there isn't this national standard for eligibility and enrollment and coverage. In general, if you're finding any summary statistics on Medicaid from CMS, it will include limited geographic information. It may summarize something at the state level, but you're not going to get county detail. Any national resource, again, would have to summarize state information to match national coverage. So the nuances of state-specific enrollment and utilization are lost. So you have to read everything with the understanding that the underlying source is truly different programs by state. There are not any diagnosis or procedure level data for the Medicaid public use files. And again, everything's summarized by broad service types or broad eligibility categories. That being said, there are quite a few resources that CMS has published. These are mostly derived from Medicaid files that we've already discussed. One is the MACS chart book. So this is available with the other MACS general information. Historically, the MACS were used to publish a chart book The year range is actually 2002 to 2013. This has narrative information that can be really helpful, I think, to people new to Medicaid. So it's adding context explanation for statistics. So not only is it summarizing managed care, but it will say, here are some considerations for what we're seeing in terms of managed care. There are some examples of how state eligibility is impacting observations. The sections of the chart book include a summary, beneficiary characteristics, expenditures and utilization for fee-for-service beneficiaries, and then sections on managed care enrollment, duals, and waivers. It also has a helpful glossary and acronyms list. So again, a very good resource for people new to the MACS data. The other two resources posted here, the Medicaid Statistical Supplement and MSIS data tables, are pretty comparable. They have aggregate summary information with broad utilization and broad enrollment eligibility categories. They're similar. The statistical supplement is in PDF format and the data tables are in Excel, so that the latter is a little more user-friendly, but the statistical supplement has trend tables starting in 1975. So there are trade-offs. I encourage you to check them out if you want to look at some summary information. One public use file that's been more continuously maintained by CMS is the state drug utilization file, and it's actually created in relation to the Medicaid drug rebate program. So this is probably the most fine-tuned nationally available utilization summary information available for Medicaid. It includes information by national drug code, and then it will be summarized by state to see utilization by year. So these can be really helpful if you are focused on prescription drug use to note frequency in advance of your project. If you're trying to get a sense of utilization over time, you can look at trends, make comparisons, and get a sense of whether or not your study is feasible. Moving on from program information and summary statistics, the rest of the presentation is going to focus on resources that support research files. And this, again, is moving what do we need to know to understand Medicaid program to what actually happens in the production of the research files. What do we need to know about the research files specifically? A lot of information about that older version of the Medicaid research files, the Medicaid Analytic Extract, is published and posted on the CMS website. And again, the MACS data are available through 2015. So people studying ACA implementation, I know there are a lot of other established studies that include MACS data. So I wanted to maintain this information. It's been in earlier versions of workshops, but just a quick summary. There's a wealth of information by year in the MACS data documentation. And I like that these are maintained by year. So they'll reflect program changes by year and then also possible changes to the research identifiable files by year. So in the MACS data documentation, if you go to the MACS general information website and look at downloads, you can pick a particular year. You'll get a file with information on record counts, data dictionaries by year, and then some interesting supplementary resources or crosswalks that were developed for using the MACS data. So there's a waiver crosswalk starting in 2005 that relates the ID of a waiver to the waiver name and the waiver type. For managed care, there's a managed care crosswalk that starts in 2009 with a plan ID, name, plan type that can be informative. And then there's also a home and community-based services taxonomy crosswalk that was developed and is available starting in 2010. This allows us to kind of organize information on home and community-based services and waivers to try to look at things nationally and see trends. In addition to the documentation by year, you'll also get data anomalies information. And we mentioned these a little earlier. This includes anything noted during the preparation or production of the MACS files. It can reflect issues like code mapping, values for variables, unexplained variation across years, and you'll get anomalies by state and by file. just one example, I looked at the 2012 documentation and I saw in a validation report that in 2012 in Minnesota, the number of enrollees with disabilities in managed care increased substantially. So that's the kind of detail that's in the anomaly report. And then the one other resource on the MAC's general info page that's really helpful is their frequently asked questions document. This is a decently long list. I think it's over 60 pages with pretty comprehensive answers. So if you have a question about the MAC's data, you might want to check that list. So the data validation tables or the MAC's validation reports, I think, are invaluable. They have a ton of information. They're by state and by year range. So instead of using benchmarks like the data quality atlas, it's more of a within a state, what's happening across years. So it's a comparison between years. They're presenting a lot of summary information, and then it's more of a, is this within the expected range or is this out of the expected range with a yes, no. The information split for utilization into claims and encounter data. So you can actually get a sense of what's happening in each state in each year for completion of encounter records or fee-for-service claims. And then there's also a lot of summary. You can get information on actual numbers of records and how many recipients had certain information reported. I think these are very, very useful before your request to ensure that your proposed project makes sense. And then after you actually are using your data, if you want to check your results, you might want to see if what you're finding is consistent with what's in the validation reports. Going back to that last example, in the anomalies table, there was that flag saying, in Minnesota in 2012, the number of enrollees with disabilities in managed care increased in 2012. And that's all the information that was in the anomaly report. But you could maybe look to see what did that mean in the validation reports. So if you pull up the validation report, you'll get the actual number that went from 16,638 individuals to 58,214 in 2012. You might want to look at complementary information to see what the implications of that are for your question. The percentage of disabled adults who were Medicaid recipients didn't change. So you can check that in the validation report. You can check the average fee-for-service Medicaid paid per enrollee, and you can check the records per enrollee. So if you're curious, that's the year that special needs basic care became opt-out in Minnesota. So that's why there was that jump. The last resource, and we've covered these already, but the last resource for MACs that I wanted to talk about was issue briefs. And these are an analysis of MACs data or in anticipation of program changes. And they're kind of comparable to the chart books in that they have narrative to support statistics or findings. And some of the ones I use a lot are the encounter data in comprehensive managed care. That's what we already talked about. There's some provider and utilization oriented reports, which is a little different than the beneficiary or recipient level utilization information that we've been discussing. Okay, so I'm going to move on to resources for the TAF data. So these are still the research identifiable files, but it's new since our last Medicaid workshop didn't cover TAF. For Medicare, I'm always pointing people to the claims processing manual because how claims are processed, what information gets recorded in the claim is what can be pulled in for the actual research files. And I think what we've been learning is it's not nearly as clean for Medicaid. We have resources for understanding what Medicaid covers and how, but then the submission system is T-MSIS. So this is maybe the closest thing we have to a claims form, which is what gets submitted by states to CMS through the transformed Medicaid statistical information system. So the T-MSIS data dictionary is publicly available. It's posted. All the information is aimed at states, but it's documentation for the source of the TAF data. So I think that can be really helpful. Another state-oriented resource is the T-MSIS coding blog. So this is available and provides support for states submitting T-MSIS information. And I think you can actually get some pretty useful background that informs the completion of T-MSIS by looking through the coding blog. So if you have a question about how well something's completed in the T-MSIS data, if you search the coding blog, you might see a ton of reports saying this is a priority area, or we're getting questions, this is how you should be completing this. And that might be an indicator that the information is not consistently reported in T-MSIS. Like all of those resources I covered for the MACS RIF, there's been a suite of resources developed for the TAF RIF. One of them actually outlines analogs, MACS user support materials to TAF support user materials. So that might be useful if you're an experienced MACS user and you're used to MACS resources. The Medicaid site has an introduction to TAF RIF, which I think is pretty helpful. And then ResDAC actually hosts technical guidance documents for the demographic and eligibility and the Medicaid claims files. And these have a helpful introduction that kind of integrate the program notes we've been discussing so far with the actual research file production process. And the most notable newly developed TAF resource is the Data Quality Atlas. We have some experience looking at it. I think this is great. It's a lot more dynamic than what was developed for MACS. I'm really excited about it. If you look at that analog to MACS support materials, you'll see that a lot of the information that was previously produced for MACS has been replaced by the DQ Atlas. So issue briefs, anomaly tables, validation tables, even some ResDAC articles, all of these resources have been replaced by the DQ Atlas. So I think some of you already have some experience walking through. If you did the exercise, here's the landing page. You can search by topic or by state. Again, the information here is reflecting state and annual variation. There are also resources to help you understand the atlas, and there's some supplementary analyses. So if you go to the topics page, the topics are broken down by file type and by area. The DQ Atlas provides this type of rating system to call out good completion of T-MSIS or potential data concerns. So again, each of these specific benchmarks have their own validation methodology, and you can learn about those by selecting a specific topic and looking at the background. So I think I picked my own issues, and I think it matches what we've covered so far. If you look at something like enrollment in comprehensive managed care plans under beneficiary information, the methodology is actually comparing Medicaid managed care enrollment and program characteristics to the T-MSIS data. So it's looking at an external report, it's looking at the managed care program information. Something a little different is plan encounters. I looked at other services, and that benchmarking is done with just the encounter records themselves. So it's looking at the volume of encounter header records, the volume of encounter line items, the average number of lines per header, and the number of plans that did not submit header records at all. The state page has a summary of the same information by state year release. So you might be looking at that topic view if you're looking at national information, but if you have more of a specific state perspective, you could look at the state summaries. And again, this is presenting the DQ assessments with those high, medium, low concern ratings. You can use it to assess differences between, or they assess differences between the TAF and some other sources. This rating system is kind of used universally across the whole atlas. The resources page is really helpful. You should probably start here. It describes the background of the production process. You'll get information on the DQ Atlas. And then there are also a few data quality resources that don't fit into the other sections. So that shared identifiers with mothers and newborns is found there. There's some information on final action. Overall, I think the data quality atlas is really well put together. It's a lot more user-friendly. You don't have to download 50 different Excel files per year of data if you're interested in understanding national Medicaid data. So I would highly encourage anyone requesting the TAF RIF to look at this in advance of the request and in the project design phase. And then again, it's a good resource as you're working on your project. And I'm just going to wrap up with a couple resources specific to research identifiable files. So the Chronic Conditions Data Warehouse is the CMS data distributor. They're another CMS contractor. They have information on their site that is going to be specific to the RIF because they're distributing the research identifiable files, and that's what they're working with. So they do have some summary statistics. You can get tables and reports, charts on enrollment and demographic information. Something else that they've developed, and I'm going to talk about tomorrow, is a pricing tool. So they actually have a population estimator that uses 1 year of Medicaid data where you can put in some simple parameters to summarize your study population or to get an estimate for your study population. The CCW also hosts all TAF documentation. So they have data dictionaries in a couple formats. They have a record layout and then a code book. They also produce analytic guidance. So their user guides are very, very helpful. I look at the one for TAF frequently. And then they also have some technical guidance and white papers. These are mostly for Macs now. I'm sure they're working on developing resources for TAF. But getting started with Macs data files has some sample SAS programs that can be useful. A lot of the white papers have some information on getting started on utilization studies. So they have information on evaluating emergency department utilization, long-term services and supports, ASCs, just good considerations for using the Macs data. And then I'm going to wrap up with ResDAC. Last but not least, we host the data documentation as well. We have all the information on Medicaid research identifiable file availability. If you select a page, besides just the detailed record layout for the files, you can get an overview of the files, and that can be helpful if you're just trying to figure out what types of services actually fall into other services because you forgot after this presentation or after this workshop. We also have all the information on CMS data release policies. So we'll be posting availability information and then any changes and data use agreement policies. And then we also host the data request documents. When you're ready to submit your request after you've done all this background research, you can get the materials on our site. So we're always interested to learn more about your projects and hear your perspective and ideas. I think I learned something new about Medicaid with almost every Medicaid request. So don't hesitate to reach out to us. Our phone number and our email address are included here. And with that, I think we have plenty of time for questions.
Yeah, thank you very much, Kendra. And I apologize, everyone. I see that I had the break time incorrect. I thought we had a break from 2:45 to 3. So I don't know if any of you will be super upset if we have more time for questions or if we get out a little earlier. But anyway, I just wanted to apologize for that. We do have one question that came up, kind of looking to clarify the T-MSIS data dictionary versus TAF. So it sounds like the T-MSIS data dictionary might have more variables than TAF, but you can use it to understand TAF. And then where can you find the TAF data dictionaries?
Yeah, that's a good question. So I did start with the thing that's a little removed from the research files. I think if you're I would start with the TAF data dictionaries, the TAF RIF data dictionaries, because that's what you would be accessing as a researcher. Those can be found on the ResDAC site or on the CCW's website. And then if you have questions about the content, I think one place to go might be the T-MSIS data dictionary. So that's providing the background information, that's the source. So if you're trying to figure out how something could be interpreted or reported, you might want to go to the T-MSIS data dictionary. And it will be a little different than what's actually available in the research files, but it is the source information.
Thank you. And I actually don't see any other questions at the moment. If anybody wants to put any questions in the chat or ask. This is our end of the day. We often have a little bit of a lag in energy. Oh, we have a question. So there are very specific instructions provided for identifying fee-for-service in the MACPAC file, but no similar instructions for TAF. Is there a good way to identify fee-for-service in the TAF data?
Yes, I think this is covered in the TAF, the demographic and eligibility technical guidance so that's posted on the ResDAC site as well as CCW's TAF user guide. And I think there's a lot more information in the new demographic and eligibility file on plan enrollment and so I think it's just a matter of getting those specific variables and stuff, sharing the links to those resources.
Sorry, actually.
I will say that we have looked in the technical guidelines for TAF for how to identify fee-for-service, and I honestly, we can't figure it out. There doesn't seem, I mean, in the MAC's technical guideline book document, there was like a snippet of SAS code. This is how you do fee-for-service. Use this. There's nothing analogous to that exists for the TAF data. And you know, the eligibility codes that you're supposed to use in MACs have now exploded. You know, there's multiple numbers of eligibility codes now in TAF, and you can't. There's like no way to crosswalk from one to the other.
Yeah,
and we've gone through that. We've gone over this with at least one of your analysts before, but nobody seems to know how to do this.
Yeah, I would say, you know, the TAF DE technical guidance, it gives suggestions for like how to categorize broad eligibility categories that look akin to MACs. And I know that we have found if you try to do that, you will find shifts in the population. It is trickier with TAF because it does include so many more people, just because it's got the CHIP and Medicaid expansion is happening at the same time. So it's really tricky to kind of, you know, track what's TAF and what's eligibility change or a change in the eligibility code. So that's one issue. And with the understanding where fee-for-service, like how can you get a pure fee-for-service kind of group? That's something else that I have not seen, you know, guidance on. It's definitely something that we can continue to work on. The within the claims, you can tell if a particular claim is paid via managed care organization, but from the DE file, you can see managed care enrollment. You could say if there's absolutely zero managed care enrollment, we have fee-for-service, but you would then miss people who maybe are only enrolled in managed care for a very small subset of the services. So it's definitely challenging. And I think that's something that as a research community, we're going to have to sort through as we move forward here.
So you mentioned that in the claims, you can see if managed care pays for it or not.
Yeah, so that's the...
If you then crosswalk back or try to do like a crosstab of eligibility type in the DE file to the claim, the eligibility type in the claim, will that tell us who's fee-for-service?
Right. So you would be able to see maybe like, I think it would be tricky because it may vary by, so eligibility group would be one thing it might vary by, but then by state, you might want to make sure that you're taking care of that. But so you could possibly, I think that is something that we, as I mentioned with this creativity and administrative claims data, that would be something to start exploring, and see if you can, parse out. So I just don't know if the eligibility categories are a firm boundary for fee for service.
Mhm.
Yeah.
Okay. Thank you.